Hi everybody, I'm Nowfel. Welcome to my channel. Today we are going to discuss regarding functions of the community health nurse. As we know, community health nurse will work in different areas. According to the area, she has to perform different functions. We can see the most important functions of the community health nurse. Okay. First one is administration. Next one is direct care. Next one is educational functions. And the last one is research functions. Okay. So first one is administration. So administration, in that function, the community health nurse should perform as a administrator or as a manager. Okay. It is a function related to the manager. Here, the community health nurse should participate in planning. The planning of the different programs like tuberculosis control program, diabetes control program, cancer control program, as well as she has to plan for the different health services provided in the community. Okay. So planning is an important function coming under the administration. Next one, the nurse should supervise the subordinates. The community health nurse should supervise the subordinate. That means subordinate means the person who is working under the community health nurse. That is the auxiliary nurse or the lady health visitor, health educator, etc. Okay. So she should supervise all these subordinates. Okay. And regarding the budget, regarding the financial planning for the next year, she has to participate in that budgeting program also to prepare the budget for the next year, as well as maintaining the records and reports. Okay, maintaining the records and reports, all the records as well as reports in the community. As an administrator, as a manager, the community health nurse should maintain all these things. Okay, it is a legal evidence. So the community health nurse should maintain all the records and reports. And the community health nurse should make a contact between the top level management and the lower level management. That is the top level management, that is the national agencies or the state level agencies, and with the lower level management she should make a contact or a communication between these two managements. Okay. So all the functions that is related to the leader, advisor or the coordinator or the collaborator, all the things are coming under the administration function. Here the nurse is working as a manager. She is participating in planning the things, as well as she is supervising the subordinate, the person who is working under the community nurse she is supervising, as well as in the budgeting, preparing the financial plan related to the money for the next year. She is being a part of that team also, as well as maintaining the record and report, as well as communicating with the top level management as well as the lower level management is the things coming under administrative functions. Okay. Next one is direct care. Next function is direct care. As we know, in community, the community health nurse provide direct care in the home setting, in the clinics, as well as in the health centers, directly providing care to the patients in the home setting, in the clinic, as well as in the health centers. Okay. So in the direct care function, first of all, the community health nurse should assess the health status of the individual as well as the family members. Okay. The first function coming under the direct care is assess the health status regarding their problems. Assess the health status of the individual as well as the family members. Next thing is identify the needs as well as the problem of the individual as well as the family members. The community health nurse should identify what are the problems for the individual as well as to the family members. After identifying the problem, the community health nurse should plan for the care. What are the care I have to give to solve this problem? Okay. After planning, the community health nurse, how you are writing your care plan, like that only, the community health nurse should implement this. That means should apply the plan you made. You made a plan and now you are applying that. That is implementation of the plan. After implementing the plan, the community health nurse should evaluate that implementation, whether it was effective or not. Okay, so the last step is evaluation and finally follow up. We know the community health service is not a one-time service. Follow up will be there. After providing the care, you are evaluating. Then after a few weeks or few months, you are again going to visit the patient, or they are coming to the clinic or to the health center. Follow up will be there. What is the progress of that patient, or what is the progress of that family? Follow up will be there. That is the things coming under direct care. The things coming under the direct care are, you are assessing the health status and you are identifying the problem. After identifying the problem or the disease of the family, you are planning to solve that problem. After planning, you are applying your plan. What are the things you have to implement? You are implementing. After implementing, you are evaluating whether that care was effective and you are doing a follow up. Okay, that are the things coming under direct care. Next one is educational function. Third function of the community health nurse is educational functions. So in the educational function also, the community health nurse first of all should assess the knowledge level of the community people. In the different community, their knowledge will be different. So the community health nurse, first of all, in the educational function, she should assess the knowledge level of the community members. Okay, afterwards she has to plan for the health education, how to do, when to do and where. Okay, all the things related to the health education should be planned after identifying the knowledge of the community. Now the community health nurse should prepare the AV aids for the health education. That is the AV aid, for example, flashcard. Preparing the flashcard for the health education. Now after preparation of this, the community health nurse should give the health education, that is implementing the plan. Okay, providing health education to the family members. You can give the health education individually or to the mass, that is to a group of people also you can give the health education. After implementing, the community health nurse is evaluating the effectiveness of the health education, whether the community members gained the knowledge or not. As well as in the educational function, not only the nurse providing health education to the community members, but also the community health nurse should participate in staff development programs. For the improvement of the knowledge of the community health nurse, she also has to participate in different staff development programs. She has to attend different classes to improve the knowledge level of the community health nurse. She is not only providing the education to the community members, but also she is also attending the classes to improve the knowledge level of the community health nurse. That are the things coming under the educational function. Last function is research function. Okay, research function. In the research function, in the community there will be so many problems related to the patient care. So many problems will be there. So what is meant by research? In research, you are searching for a new thing. Okay, again and again you are searching for a new thing. That means in research, you are trying to find out a solution to a problem. A problem will be there in the community setting regarding the patient care or related to any services. A problem will be there, but there is no solution at present. So as a community health nurse, the community health nurse should identify that problem and she will try to identify a solution to that problem. Or in a community, a question will be there that is not solved at present. At present, it is a question. There is no answer to that question. So in the research function, what the community health nurse is doing, she is trying to find out answer to that question related to the patient care. Okay, so identifying the problem of the community related to the health care. The thing coming under the research function is you have to identify the problem of the community related to the health care. Now you have to try to find solution to that problem. The community health nurse should try to find the solution to the problem. How you can find a solution to the problem? You have to conduct the research. Okay, so after conducting the research, you will plan such and such care if I provide, I will get a solution. The community members will get a solution to this problem. So planning for the research as well as after identifying the solution, you will get a solution. After conducting the research, you will get a solution. After getting that solution, you have to apply that or you have to implement that solution. Okay, after implementation, you have to evaluate the outcome. How the community members are getting now, whether they are satisfied with this care as compared to the past. That is the research function. You have to identify the problem. You have to try to find a solution to the problem. After finding the solution to the problem, you have to implement or you have to apply that solution and you have to evaluate the outcome. Okay, that is regarding the research function of the community health nurse. That's all regarding the functions of the community health nurse. We will meet soon with another video. Till that time, thank you and goodbye.